Right. Thanks, everyone. Now we're just going to kick on into the webinar now. So I'll just do the introduction one more time. Fraser May here, Civil Contractors New Zealand Comms Advisor. Then we've got Stacy Goldsworthy, the Technical Manager for CCNZ. Give us a wave, Stacy. We've got Chris Alderson, who is the Construction Health and Safety New Zealand Chief Executive. Hi, Chris. And we've got Suzanne Watt, who is the guest speaker today. She's a bit of a surprise addition to the list, but it's really good to have you on board, Suzanne. Hi again.
Thanks. Hi.
Okay, so this webinar is going to take about 50 minutes, and do feel free to use the chat function to ask questions. Without further ado from me, I'm going to let Stacy take it away with a bit more of an introduction.
Thanks, Fraser. Thanks everybody for attending this webinar today. Yeah, we've been a bit oversubscribed with numbers, so hence we're running this the second one. I suppose just to outline what's happened. So 2 or 3 weeks ago, the Construction Accord put together a small team, or helped organise a small team of both horizontal and vertical health and safety practitioners and also operational people to start to pull together what sort of protocols would look like. In the background from that, Suzanne started to pull together what standard would look like. We got information from everywhere, from all around the world. You know, we've got a lot of sources of information. That was all pulled into SiteSafe, where they took all that and then basically distilled it down into some of the key messaging that was coming out from around the world. We also looked at Ministry of Health and what their messaging was, what they were saying, and also the World Health Organization. They, they've been changing their messaging and what they've been putting on their website through this whole COVID-19 pandemic. So we've been picking up on that. I suppose just to start with, yeah, that smaller team that's pulled all these protocols together. Joe Prigmore from Fulton Hogan, Carl Tonks from Fletcher's, Andrew and Adam from SiteSafe, Stuart Chapman from Hawkins Downer, Anne-Marie from SiteSafe, Pete Lockhart from Naylor Love, John Salia from the Commercial Bay. Been pretty much the key team, so yeah, great effort there. But also probably our wider membership that we've consulted with to make sure that what we have developed is going to work from not only from a health and safety point of view, but also from an operational point of view. So the way that it's kind of worked in the background is the team over at SiteSafe have provided a lot of that back room horsepower, putting all that information together, distilling it, using the graphic design team to make all that that look good and like a snazzy document that we do have, and quite complete as well. But from the front end, Chaz, Chris and his team over there have been pretty much leading the development of the standard and also liaising with government to get the standard and the protocols approved. So it's been endorsed widely within government, and it's probably a good time now for Chris just to have a chat to that. Chris?
Yeah, great, Stacey. Yeah, thanks. So look, yeah, Chris Alderson, CEO, Construction Health and Safety NZ. For those who don't know who we are, we're a charitable trust. We were set up about 2 years ago as a lead health and safety body for the construction industry. We sit between government and the industry. And if you are interested, you can have a look on our website about the board members who broadly represent the different components of the construction industry. For the civil sector, Steve Colleen, the CE from Downers, sits on our board. So look, as Stacey said, probably about 3 to 4 weeks ago, we started seeing this situation emerge around the fact that we needed to get our act together in terms of coming and working with government around what safe operations would look like under alert levels 3 and 2 as we knew them there. And this work started. So we did have an advantage in that we had this thing called the Construction Sector Accord already up and running, which had been set up around 6 months earlier, which was an engagement channel directly between industry and government, primarily through MB, to talk about some real big structural things that we wanted to see improved across the construction industry. So there were 4 government ministers engaged around the construction accord. So when all this blew up around COVID-19, we already had a really nice mechanism to directly work with government around what now became a little bit of a crisis team around, look, how's construction going to get up and running? So that's the bit of a background around CHASNZ and the construction sector accord. We were lucky, and I say that because a lot of other industries don't have this, and I think they're scrambling at the moment to put similar protocols out. I think we're ahead of the curve here, and our objective has been to get this information out and socialised as early as possible, so the likes of yourselves on this call have some opportunity to think about it and respond appropriately. So look, I call this whole thing a framework, and there's 3 components of the framework. At the very top, there's the COVID-19 standard for New Zealand construction operations, and that standard is a Word document that's sitting on the CHASNZ site, as Fraser talked about before. Download it, have a look at it. What that is an industry-wide view on what the minimum requirements are for safe operations, if safe construction operations under COVID-19. I mean, at the moment, it's basically level 2 and above. So it's a document which talks about requirements, it talks about principles. Essentially, it's the what you must achieve. A lot of it refers back to Ministry of Health advice, but it's pretty much I guess the static version of what we believe, whether you're working in residential, horizontal, vertical, in the trades, in professional services, no matter where you come from, you need to have a look at this document, because that's what you're going to be held up and measured against. So the standard, as I said again, is available on the CHASNZ website. All this information is available on the CHASNZ website. Underneath the underneath the standard protocols, there's actually 2 protocols at the moment. There's the one that Stacy's going to work through today more in detail, which is the horizontal and vertical teams, and being worked on by all those good people who have devoted their time so far to achieving this. There's also a residential standard, which is a slightly, it's not cut down, but it's a more nuanced version of the protocols that's probably easier to read from a small business point of view. So they both align around the same structure, all documents do. So when you look at the standard, it talks about what you do before your employees come to work, it talks about site entry, it talks about operations, it talks about leaving work, and then it talks about emergency management. All our documents follow that same really simple flow around, let's call it, getting ready for work through to that, okay, here's what work looks for. So I'm sure Susan's going to drop in a minute, but the document, the standard, has been endorsed by WorkSafe, and therefore WorkSafe have the ability under the Health and Safety at Work Act under 2015 to use that as a reference material when they go out and look at sites and look at what safe operations look like. Our view is that this is the what. We do understand that how businesses achieve the standard will look differently depending on the circumstances, which is the bottom box, which is down to individual business and site plans. So it's very important, I think, at the beginning to make sure that everyone knows that they do need to be planning for operations to start, and those plans need to be they don't need to be pages and pages long, and there's some good templates available on both of those protocols for how to do that, but they do need to consider some of the risks about starting up, and the risks obviously to avoid transmission of the COVID-19 virus. The plans themselves will probably be evidence from a WorkSafe point of view around, are you actually achieving the what's reasonably practicable within the Act, and those plans should be well communicated and worked on and involve your employees as well to make sure they're up to speed and they're actually sure about what they're doing. It has been an issue that we've seen for other organisations working at level 4, that there has been a large amount of absenteeism because people are genuinely afraid of coming back to work, which is a natural emotion. You know, a lot of people will be tied between that need to actually put meals on the table and get the money rolling versus the fear for themselves or their loved ones. And these documents themselves are really important to actually give not only government the confidence that we can operate safely, but actually to give our workforce and our workforce's families the confidence that we have got this under control as well. So look, I'll finish there and probably just add in comments throughout the rest of the webinar. But Susan, over to you. Did you want to say something?
Thanks, Chris. There's a couple of key things that I guess from a WorkSafe perspective we want to get across. The first is that yes, these standard protocols are endorsed by WorkSafe, and they are you guys as a construction industry are the first industry to actually have yours endorsed. So big well done to you guys for leading the charge across the nation, which is absolutely fantastic. When people do prepare their site safety plans, you need to do it for every site that you have. That includes any office, any depots, and multiple different sites that you might have operating across regions or districts or wherever your work takes place. Key things about when you're developing these plans is that you are required, like you are for everything else under the Health and Safety at Work Act, to do these plans in conjunction with your workers. So good worker engagement. If you're not sure what worker engagement is, hop on the WorkSafe website and search worker engagement, and you can find out actually what kind of things you should be doing to engage your workers in that space. When you are preparing them, make sure you use your hierarchy of controls. Start with eliminating the risk first, then look at how you can substitute the risk, what engineering controls you can put in place, what administrative controls you can use, and then lastly, you look at PPE. So always start with elimination first. So that's your hierarchy of controls. There's kind of a few questions that you could ask yourself, and I'll be really quick with these. Key questions, and if you're taking notes, this would be a really good time to take some notes. What in your site safety plan, you want to be thinking about what will be done to manage your risks from restarting your business after lockdown. So think about things around, you know, has your scaffold got new tags? Because you really shouldn't be going on it until it's retagged. And what will you do with your workers while you're waiting, for example? Have a think about how you will ensure all your workers know how to keep themselves safe from exposure, because not everybody is as up to date and informed as we might think they are. Have a think about how you'll gather information on the wellness of your staff to ensure that they're actually safe to be at work and safe to do work. Think about how you will operate your business in a way that keeps workers and others safe from exposure in general. How you will manage an exposure that's found on your site or sites or in your office, or any suspected exposure. So how you're going to deal with that contact tracing in particular. How you're going to evaluate whether or not your work processes and controls are actually being effective. And lastly, how do the changes that you need to put in place for COVID-19 impact on the risks that you're currently managing? For example, falls from heights, worker fatigue, general health and safety. So if you're starting to think about those things, you'll start putting yourself in a good place to have a really good site-specific plan. And WorkSafe inspectors will be doing random audits of site plans. So, you know, don't think that you'll get away with not doing them. Yeah, it is strongly recommended / required that you do them for each site. And that's all I really need to say. Thanks.
Thanks, Suzanne. I suppose back to the protocols, they aren't complete. They are going to be a living document. So because you guys have all registered for this webinar, we'll have your contact details. So as and when we do update them, they'll be posted on the Chazan's website. So that'll be the one source of the truth, and we'll continue to point you towards that. So the protocols are pretty much written as 5 sort of key areas. We're going to take them that you guys have spent most of the weekend poring over them and know them intimately. So we're just going to work through some of the detail as Suzanne and Chris have mentioned. So they basically run into 5 key areas. So what to do with people prior to arriving on site, site entry, site operations, leaving site, and then sort of those management protocols. One of the key things is you need to have all your staff inducted. with these protocols, but also induction around critical risk and key risks on site. This shutdown is, for most will be at least 4 weeks, probably maybe 5 or 6 weeks. So there's going to be a similar type reinduction as you'd get after the Christmas lockdown, which is only sort of two or so weeks. So you need to make sure that you have your workers inducted. It's going to be, as you'd expect, a bit difficult, considering that the protocols generally say that it should be done prior to arriving on site, or small groups on site which require distancing. So you're going to have to give some thought around that. For most projects, definitely during the ramp up, the focus is going to be on critical path activities, and also those activities which support that critical path. So it's not going to be Thursday morning if we get the go ahead later on this afternoon that everybody just turns up to work. So you need to work with your clients on what that looks like, what a stage ramp up does look like, communicate what is on that critical path. Also, as part of that, you'll need to bring your supply chain along as well. So civil contractors have been engaging with parts of our supply chain. I know that the vertical guys were looking at getting into that this week to discuss more specifically what site deliveries look like, how it's going to work, how do you maintain distancing, and how you keep good hygiene. Site-specific plan. Suzanne's given a pretty good outline what WorkSafe are going to expect. I suppose there's the 3 key issues around any site-specific plan. From COVID point of view, are going to be good hygiene. You maintain good hygiene, especially in canteens, sort of mess areas where it's going to be used by multiple people. Probably should really be staged when people do use those type of environments. And also just around frequent touch points like light switches if you're in vertical, or around equipment. Contact tracing is quite a big is a major requirement when we go back under level 3. At this stage, we've been talking to a couple of companies around apps and different technology that's being used for on smartphones to look at contact tracing. We haven't seen anything to date that we could approve or endorse. So as in the interim, the workers may need to do that on a paper file. So you need to make sure that you are collecting that in a way that's not going to spread COVID if one of your workers has that, and that it is available if required, if there is a cluster in your work site, or if you have an employee that does have COVID-19. And the other one, which we'll discuss in some depth, and Chris will probably talk to a bit later, is around the distancing. We got a message from the government midweek or mid last week, around the 1 metre versus 2 metre. So that has added a little bit of confusion. So we'll have a discussion about that. But
it's going to change the next slide for you, Stacy.
Yep. As Suzanne mentioned, it's not business as usual. You got your requirements, PCBU requirements, as required under the Health and Safety at Work Act. So you will need to look at critical risk, and you'll need to include these protocols as part of your site-specific safety plan. As part of the address last week, Jacinda did talk around a self-registration scheme. Chris, do you want to just have a talk about how you see that going down? They said they were going to give more information this week.
So I think I don't think I can't give you 100% on this, but my feeling at the moment, it's going to look more like, as Susan was just talking about, a requirement or an expectation that all businesses do have their site-specific plans in place, and that at any stage, people might be asked to explain those or show them to the regulator. I think that's the approach that MB are looking at the moment. So, for example, I think the regulator, the approach that the Prime Minister was talking about before was probably more a primary industries approach where they can actually go out and know every single food company in New Zealand, whereas in construction that's not quite the same. So I think our approach is really just look, everybody have your site plans ready, and compliance will be managed by WorkSafe, as per what Susan said.
Thanks. About 10 days ago, the government produced some procurement guidelines, and these were subsequently published. As part of the wrap up to this and the previous webinar, we'll send that link out to everybody so that you have got it. For those that aren't aware of them, the three sort of key sections as it relates to us is around suspension and variation. So that talks about 3910 contracts, and that specifically contract will be entitled to variation. So once you get that link, if you aren't aware of it, it'd be good to understand where you sit from a 3910 point of view. The other section was around cash flow and different mechanisms that may be available from clients to help assist with cash flow. And already we've seen a couple of examples out there where cash flow's been advanced, so that companies, once we come out of 4 and move into 3, hopefully 2 and then 1, that we've got an industry that's ready to work. And the last one that relates to us is just around hardship. So we'll send that link out for those that aren't aware of it, and then you'll be able to see what's or how to make an approach to your client if required. One of the key things is around good hygiene practices. So as part of the development of the protocols, we've approached an epidemiologist at Auckland University, and they've gone over what we've proposed, and they're largely happy with it. We've had no real significant changes from them. I suppose around good hygiene, one of the key messages was them around washing hands in the 20 seconds. Is just as important as the washing. So sanitizers, you've got access to them as well. They're pretty much key. Washing down surfaces, definitely in mess areas and the like, at frequent touch points, making sure that they're washed down, definitely at the end of shifts, if you've got staggered shifts. And there is that need also to protect people in their home bubble. So in the protocols, there's some of the discussion around what people should be doing when they do get home, around not touching anything when they enter the home, and then how they, or the work clothes and how they deal with them. So a question that came up around laundry, the original guidance was around 60 degrees for washing machines, but with some washing machines not being able to get to 60 degrees, the guidance from the epidemiologist is around including soap and detergent, and line drying is better than machine drying, and that's around soap plus sunlight. So that's our recommendation for people taking their work clothes home to wash them. Been discussion around smoking and vaping. So the early evidence is that exhaled smoke more likely to carry the virus than exhaled vape. The low voltage vapes make less smoke, but having designated areas where you have smokers, and also probably staggering smoking breaks in those areas would be a good way to keep probably that additional distancing that's required, because of the possibility that the smoke may spread the virus further. The second, one of the key points is around distancing. So there's, with the government announcement last week that in controlled environments that they were going to allow it to go down to 1 metre. This did create a bit of confusion, and there's still a fair bit of discussion. But Chris, do you want to talk to the 1 metre, 2 metre distancing?
Yeah, so I followed up with Ministry of Health after that announcement last week, and so the reasoning that I've been told is that 2 metres is the public area type advice. So in the public area, it's very hard to actually do track and trace, obviously. So if you're on a beach or in the supermarket or out in public places, actually track and trace is impossible. However, if you're in a school or you're in a workplace, then track and trace is totally possible. So that's why there's been an allowance to actually move from 2 metres to 1 metre within those more controlled environments. Having said that, they also referred to the fact that the advice had changed from the World Health Organization, which I immediately went and checked, and it has. So the World Health Organization are also saying 1 metre at the moment. I think the approach that we've taken within the protocols is the right one, though, because everybody's been sitting here for the last 4 weeks knowing that 2 metres is a safe distance. We've been indoctrinated there. And I think just throwing all our workers back into a 1 metre space without any kind of explanation is not a good thing. So I think within the protocols at the moment, there's a pragmatic, balanced approach that says, look, 2 metres where you can achieve it is what you should be going for. Anything below 1 metre is not allowed. But if you're finding that the work cannot be achieved in a reasonably practical way, then with adequate controls, yes, you can go down to 1 metre. And those adequate controls are, at the very high level, what Susan was talking about before, the hierarchy of controls. So of course, try and eliminate the work first. If you otherwise substitute, go through engineering controls. If there's barriers you can put up, and PPEs like at the bottom of that list. So yes, PPE might be effective in some limited occasions. If someone is symptomatic and you're working within 1 metre, then we know that perhaps putting a mask on them and that at that stage might be an appropriate thing to do. So again, it's about finding that right balance, guys. I know that there's some questions that's come up around what does that mean for transport. Again, the same thing. To me, it would be pretty negligent if we had 4 guys driving around 4 different households and sticking them into a Toyota Corolla and then driving 50 k's. That would be not a good thing to do. But if you've got a large enough vehicle where you can actually have a bit of distance between people, look at public transport at the moment. They have vacant seats beside them. I think that's totally achievable again. So it comes down to just using our pragmatic common sense in this as well, and just balancing up the health needs of the individuals with the health needs of society, and making sure that we can get the work done, but only with suitable controls in place to make sure everyone's comfortable.
Yeah, just to add to that, the cantines and sort of mess areas, the high vector areas. So we therefore do recommend that at least 2 metres distancing is applied there, and staggered shifts and good cleaning after each shift. Next thing I want to talk about is just around the vulnerable worker. So the ministry provide guidance on what are vulnerable workers. So as part of their guidance, people with serious respiratory disease, or chronic lung disease, moderate to severe asthma, serious heart conditions, immunocompromised conditions, severe obesity. So their recommendation at the moment is a body mass index of 40 or higher. So if you do have employees that do have a body mass index over 40, then you probably need to be having a discussion with them, as they could be a vulnerable worker. People with diabetes, chronic kidney disease, people undergoing dialysis, and liver disease. So the ministry provide that guidance. We've probably it does change, so we recommend that.
Stacey, the other thing to note, Stacey, is that if somebody might not be vulnerable themselves, but if they live in their bubble with someone who is vulnerable, they become a vulnerable worker.
Yep. So we did, Chris touched on it before about the role of PPE. So if you're working outside of 2 metres, you should be okay with your PPE, just your standard PPE that's determined by risk assessment. If it's critical risk, then you need to have your standard issue stuff. When you start to work within 2 metres, this is where you need to undertake a risk assessment, and from that you determine what PPE you do require. I suppose access to PPE has something that's come up from several quarters, especially amongst the small and medium companies that sometimes don't have the purchasing power of the others. So yeah, it's not a matter of going out there and buying up PPE as and when required. You assess the task and just buy what is required for your operation.
So maybe I'll just jump in again, Stacey. So this one was obviously, when you look around the world, there are some places in the world where masks and gloves are being recommended. So what you'll typically find in those countries is that they've got widespread community transmission. So we're talking Northern Hemisphere, we're talking parts of Asia, and they've got high population densities on public transport. So the reason why in those countries they're recommending a mask, for example, is to stop people who are symptomatic spreading it. So obviously you contain the droplets in your face. What they don't do, and this is universally accepted by World Health Organization and everybody else, is they don't actually, masks are not a good preventative measure for people getting COVID-19. So you do need a certain type of mask, which is not readily available. You do need certain training in terms of face fitting. And even when you've got all those things, we know even from the medical and the health world that people are still getting infected. So they're not seen as an effective control there. So the other thing we don't want to do is we don't want to go out there with a protocol at the moment that meaninglessly advises people to wear gloves and masks when they're actually not going to protect them. And at the same stage, we're actually pulling all that stock away from the people who really need them, which are our health workers. So that's the reasoning why at the moment, unless there's special circumstances, unless you're maybe working with guys in very close quarters within that 1 metre, we're saying it's not a standard control for construction sites.
Yep, thanks. So I mentioned contact tracing at the outset. You're going to have to develop records so for all your workers. They're going to have to be part of their induction, and part of what they do coming back to work is to record who they come into contact with. That'll probably have to extend outside the workplace as well and into their bubble. So under level 3, government's position is that you can extend your bubble, but not significantly. So people will need to record who they are coming in contact with. So from an emergency response plan, if they do have emergency response, there's going to be the requirement that the services come to your site. It's not going to be standard as it is now. So you are going to have to look at what that plan will look like. So make sure you cover off the requirements and the protocols. Suzanne, is there something you want to add into?
Not at the moment. You can come back to it later if you like.
Okay. Yeah. So I suppose it's a matter of us as an industry getting it done. As Chris mentioned, the education sector aren't as prepared as what we are. When we went to level 4, a lot of the pack houses around the country, it took them a couple of days to look at what their protocols are and what their controls are, and put appropriate controls in place. We're a bunch of contractors and engineers that build stuff, so we should be able to at least do the same. So it's a matter of using your imagination on how you can achieve these. Also, you need to be talking to your clients. They're pretty much going to be the signing off all your site-specific safety plans, how you go back to work. So there needs to be a real dialogue, and we're seeing that already, especially with the likes of sort of Vaping, ZTA, and some of the 3 waters, about how these contractors are going to get in there and start getting back to work, both in level 3 and also seeing some discussion in level 4. So moving forward, we're starting to have the level 2 discussion probably in the next few days, once we get a steer from the government on what they see level 3 looking like. The initial guidance from government is that it won't be much different from a level 3 and a level 2. But as we get more messaging from them, we'll adjust the protocols and develop protocols to fit that level 2. So that's sort of the run sheet that we've got at the moment. We have had some questions back already prior to this webinar. One of the key questions that we had was around interregional travel. So that's outside your region. Some of the larger projects, even some of the vertical guys that living in the Waikato and working in Auckland, they've had discussions about what is that interregional travel. We approached CCNZ approached NZTA on Friday afternoon to get their opinion on what interregional travel looked like, and they had gone back and approached the government on what they saw it as. We're still waiting to hear back from NZTA on what that means. So once we get an opinion from them, we'll publish that, and that'll be on the updated protocols, probably on the Chazan's website. Suzanne, do you guys have an opinion on interregional travel, or you waiting on?
I don't know. I don't know that we have a organisational sort of stance on that at the moment. I know there's a lot that we're working through today. My phone's been going off hot all day. I would expect that probably tomorrow morning we'll have some more information online around what Alert Level 3 is going to look like. And also, for if anyone's wondering what it looks like for our inspectorate and the work that they do, there should be some information going online later today. So I would check back tomorrow when we've also had a chance to hear the minister's briefing today. Yeah, that's kind of where I sit on that.
Excellent. Another question we had is around winter works, and once we start ramping back up, what that pushing the work program into the winter. I suppose with your client, there's going to need to be a discussion on quality and how some of that works. If you're looking at an earthworks, maybe fill drying, bearing some additional costs to get some of the program done. From a pavement point of view, looking at putting in additives such as foam bitumen or cement stabilisation, maybe ways to ensure that there is some quality, delivering a quality product, which is generally adverse conditions. So again, around that winter works, it's strong engagement with your client, looking at what the risk factors are around undertaking that work, and then putting in appropriate controls as and when required. No doubt there'll be some questions from this webinar. Fraser, have you got some there that we could
yeah,
have a look
absolutely. So people have been sending through some really good questions. I thought while we're covering them off, let's scroll through to the end. So this is the protocols document. It came out a bit blurry in the presentation, so sorry we didn't kind of cover it off in a structured way, but I think everyone's hopefully read this that is watching the webinar. So just going to scroll to the end of it. We've got a link coming out after this. So if you've got any more detailed questions that you want to ask, then we've got a quick survey which just gives you the opportunity to ask those in a bit more detail, and we will get all of the chat questions. So do feel free to use the chat function there, and what we can address in the FAQ document, then we'll look to do that. Now, the first question, I guess, was sewage transmission and any risk of infection that came from that. Does anyone have any tips on that? I thought it was an interesting question, but I'm not sure there's any definitive about that at the moment, is there?
It's probably more a question for our public health people, I think, Fraser. I think I've seen a little bit in the media about it, but like everything, I don't trust everything in the media at the moment until I've had someone have a look at it. Yeah,
so maybe some stuff on it, but it's 100% verified. Yeah, is that right? No, anyway. Yeah, another one was about vulnerable workers. Is a worker classed as vulnerable if his or her partner works at a rest home? And how far does one go to classify as vulnerable? It's from Calvin McCluckey.
Yeah, I don't have the answer for that one either. Interesting question. I don't think my gut feel would be it probably doesn't meet the strict definition of a vulnerable person, but it's definitely something someone should take into account.
Yeah, on the guidance, it says residents of aged care facilities. Aged care facilities are susceptible to the rapid transmission of viruses like COVID-19. Residents are more susceptible to illnesses due to their age and also more likely to have underlying health conditions. So it doesn't really sort of say much around whether your partner is maybe a vulnerable worker. But it's probably a high risk, so you'd look at probably the highest level of control, which is probably elimination.
So that's cool. So another one was around the minimum information people should collect. So Kay Jones said persons entering and exiting a workplace need to be registered to assist tracking of contact in the case of infection. Whether any standard forms are available, minimum information that we should be collecting. Then someone further on as well said whether it was appropriate for main contractors to be collecting names of home bubble names of workers and their families. So 3 questions there, I guess. First is, what's the minimum information people should collect?
As part of the protocol, there's a form in there that.
Right, in the protocols?
Yeah. Around site registration. I believe it is. Let's see, I'll scroll to it.
Right, and that's site specific.
Yes, there's a sign in the register, and it talks around contact tracing as part of that. So that's as part of the protocol. If there's other risk with your site, then it's taking that form and expanding it would be definitely advised.
Yeah, great. Okay, and
one of the other questions?
Yep. So someone else said, there were a few questions around the templates. Now, my understanding of those templates is that some of them are a work in progress. When templates that are recognised are ready, they would be posted to the chessens.org website at www.chessens.org/COVID-19. But Suzanne, just wondering, does WorkSafe have templates available for that sort of thing?
I'm not sure that we have them yet. I think we're very much leaving it up to the industries to do that, because when we put out a template, we can't customize it for absolutely everybody in every situation. So I know there will be some information coming later today. I just don't know exactly what that information will be that gets uploaded. So I don't want to say yes, there will be in case there won't be. But do keep an eye on the website, because if anything is going to go up, it will go up on our website. And obviously, like myself, I will put it out to Chazans and they will load it up to theirs, and we'll be doing that across all the sectors we work across.
Yeah, exactly. So Fraser, on the Chasms page, there's actually 3 boxes there. It says there's a residential protocol, the horizontal and vertical, which we've been talking about today, and then the next box says, I think it says tools and resources, and all the templates, if you click on that box, that we have currently are under there. We're also collecting other tools and templates that other people have found useful and are willing to share as well. So if you do see some particular good stuff out there, and you're willing to share it with the wider construction industry, which I'd encourage, we can actually make it available there as well, because, hey, look, there's plenty of people out there working on some pretty good stuff at the moment.
Fantastic.
Yeah, I do support that. Yeah, we've had a lot of information from different areas, from different industries, and a fair bit from even from our industry, around TTM, operational plans, and they've all been pulled into one so that we can take the best bits. So yeah, if you do have anything or see any good practice out there, then please provide that.
I just also make a pitch as well. I've asked the Mates in Construction guys to put together some guidelines for how you actually work through some of the mental health issues that we might actually run into with our workers as well coming back to site. So those should be available mid during the week, and we'll create some links to their website.
Okay. Magic. Well, I think we kind of intended for about 45 minutes for this webinar, and we've come up against it now. I appreciate everyone's got to get back to work, but I know that everyone's really holding out to hear the information and the announcement later today about whether we and when we go back to the level 3 alert, level 3. Sorry. So yeah, I think when that happens, we'll know a bit more. And the situation at the moment, ever changing, changes every day. So best place for information on what we're trying to do is with the sort of whole protocols is to have a central source of information so that it's clear and it's consistent, so that everyone can work to a plan, and that there's some clarity around expectations. So on that note, I'd like to thank first off Suzanne Watt from WorkSafe, the engagement lead, for joining us today at very short notice. Thanks for your time, Suzanne.
Thanks.
I'd like to thank you as well, Chris Alderson, the Chief Executive of Construction Health and Safety New Zealand, for your time today. It's been really great having you to tell us a little bit more from your perspective, and Stacy, a bit more from your perspective. And Stacy, thank you very much for giving a bit of insight into the technical side of the protocols, and fantastic job. Everyone else, do feel free to use the chat function to ask any further questions. We'll be sending you out an email with some links later today that will also have a bit of a link to the survey to ask any further questions in more detail. And we should have hopefully a webinar recording out to you in the near future as well. Thanks for your time, everyone, and have a good day.
Cheers, guys.